Government of the Federation, Honorable Ministers, Directors General, Heads of Agencies here present. As of today, the 1st of April 2020, Nigeria has recorded 139 confirmed COVID-19 cases. 82 are in Lagos, 28 in the FCT, 8 in Oyo, 5 in Osun, 4 in Ogun, 3 in Kaduna, 2 each in Bauchi, Edo and Enugu, and 1 each in Benue, Ekiti, and Rivers States. A breakdown of the cases shows that 70% are male, while about 30% are female. The age range is mostly between 30 and 60 years, but I must be quick to stress that both men and women of all ages can be infected. 9 persons have been successfully treated and discharged from hospital, and 2 deaths are the only ones still on record from COVID-19. Both persons had serious underlying ailments, which no doubt aggravated their conditions. The Federal Ministry of Health is using the window of opportunity of the lockdown in the FCT, Lagos and Ogun to accelerate activities to detect, isolate, and treat cases. This is important because our ability to achieve the objectives in these states and the Federal Capital Territory will largely define our success in slowing the spread of infection in our country. As federal and state governments deploy human and material resources to achieve this end, a critical factor will be the cooperation of members of the public. I shall at this point remind everyone of the injunctions of His Excellency the President to all citizens to stay at home in the areas under lockdown. There is no need for travel. You are safe where you are. And by doing this, you would have contributed a lot to the efforts of government to quickly put coronavirus under control and return to our routine activities. As part of preparedness in the ABUJA metropolis, we have over 1,000 bed spaces ready for isolation and treatment of mild to moderate cases, which we can expand if need arises. We have ICU units ready in Gwagwalada and National Hospital for those who may have complications, especially those with the underlying illnesses like tuberculosis, HIV, cancer, and also the elderly. We again urge families to protect their elderly and vulnerable people by not exposing them to unnecessary social hazards. I held a press conference, I held a teleconference earlier today with state commissioners of health, during which many issues were covered to have a better alignment between the federal and state structures. I urge them all to identify and establish isolation centers for treatment of mild and moderate cases, as well as ICU units. Lagos State has expanded its isolation wards to surge capacity, and Ogun State Governor yesterday commissioned over 200 bed capacity isolation centers. I urge other states to prioritize identification of the same within their states, beginning with our tertiary hospitals. They are ready and have been instructed to make space available. All facilities, including private facilities where isolation and treatment of coronavirus infected persons are to be conducted, will be visited for accreditation by a team comprising experts from NCDC, Federal Teaching Hospital, Irwa, and headed by the Honorable Commissioner of Health of Lagos State. The Office of the National Security Advisor shall be invited to join, since coronavirus disease has national security implications. The team from Federal Specialist Hospital Irua has arrived in Abuja, led by the CMD. We have engaged hundreds of ad hoc staff to support response and Port Health Authority staff previously stationed at the airports are to be deployed to land borders and also to key interstate roads, along with security agencies, to randomly screen and monitor the health status of those travelers who are allowed to ply the road, in order to allay the fears of local authorities, so that local roadblocks at key points in certain states will no longer be necessary. I must applaud at this time the efforts of all our health workers and other emergency responders at this critical time, especially those who go beyond the call of duty. As of now, well over 2,000 persons have been tested, with the hope of further expanding and improving diagnostic capacity across the board to shorten turnaround time and increase volume. Since this week, 2 more laboratories were added to the NCDC network of molecular laboratories for COVID-19 at University College Hospital Ibadan and Federal Teaching Hospital Abakaliki, Ebonyi State, increasing our test sites to 7 to start scaling up testing capacity with hope of even further increase when human resources are mobilized for round-the-clock shift duty. A call is hereby issued for certified public health laboratory scientists and also doctors and nurses, especially in the FCT and Lagos area and Ogun area, including retirees, to indicate interest and readiness for duty by sending an email to NCDC or using the call lines. With regard to rapid diagnostic tests, none of these tests offered in the open market have been validated by the World Health Organization. The results they give are not reliable. You have to be tested in one of Nigeria's presently 7 molecular laboratories to have valid results. Vaccines against coronavirus are still a long way off, so that interventions such as social distancing and self-isolation are all we have to curb the spread of the disease. We must all continue to obey directives and measures instituted by the government, even if not convenient for us, and take them as a sacrifice for the common good. Finally, I thank our partners for their support and cooperation, and as always, encourage all citizens to continue with the following. Wash your hands frequently with soap and water, or alternatively use alcohol-based hand sanitizer. Maintain a social distance of at least 2 meters between yourself and others, especially when they are coughing or sneezing. Self-isolate if you feel ill and you have known COVID-19 symptoms or have been in company of anyone who's returned from abroad in the previous 2 weeks. Immediately call NCDC on 080097 000010 or call the emergency number 112 on your state Ministry of Health. The emergency number is being linked with the NCDC number by NCC. The emergency contact for all states are also available on the website covid19ncdc.gov.ng. Stay away from all people if you feel ill, and clean all frequently touched surfaces with alcohol-based disinfectants daily. Cough or sneeze into a tissue or a handkerchief and cover your mouth and nose with this tissue. Dispose of them in a covered bin and wash your hands. Alternatively, if you do not have any of these available, cough and sneeze into your sleeve at your elbow level. And thank you all very much for listening.